My name is Dr. Álvaro Furtado. I am an infectious disease physician. I work here in Brazil in two big hospitals of one of the biggest of Latin America. And these two hospitals are working to manage patients with COVID-19. Here in São Paulo is the epicenter of the disease. And the hospital is becoming more overcrowded. And as a physician, we have to manage this. And the moment inside the hospital is very tense. All the people are worried about to getting the disease, and nurse and physicians. At the same time, we are seeing friends of ours getting sick. It's a very new situation for medical physicians. First, to arrive at hospital and put the protection during all the day. It's not easy to use this kind of protection with the mask and the clothes during 12 hours, during 24 hours. In a typical day before COVID-19, we see a lot of patients, different diagnoses. We know about the disease. We know how to deal with the disease. For example, I am infectious disease. I see HIV positive. I know how to treat. I know how to deal. I know the prognosis. I know how to talk with the families about the disease. But now, for example, the family asks us, what is going to happen with my parent? We don't know how to say because we really have a lot of questions. We are working all the time. We have to study the disease because the science is very dynamic and the knowledge about the disease is growing every day. Reading papers and have to separate fake news about what's really scientific. The biggest problem here in São Paulo that we are not testing everywhere. We don't have enough tests. We didn't know the dimension of the disease here, the exact number of patients that have COVID-19. We didn't plan to the hospital the number of beds and things. This is very crucial for the disease now, to have the exactly numbers of the cases, to have a specific plan for the hospitals. The challenge here in São Paulo is the balance between how the government can sustain this decision to stay home, and there's a very huge part of the population that say, I'm not going to stay home because I need to work, because I'm not going to have money from government to buy the basic things. Especially here in Brazil, in São Paulo, it's a very hot area and people want to go to the park to do physical activities. And 50% they are not respecting stay home, and the government are enforcing penalties for people that get out. And this is the real problem here in São Paulo. To balance between these two indications. I have to work, but I have to stay home. One of the things that inspired me in this pandemic of COVID-19 is that the medical staff are very united. We are discussing every day. We are talking all the time. And the other thing that inspired me in this situation, when I saw old people over 90 years old getting out of the hospital, and there is a hope for other patients. The patients are very isolated. They cannot talk with the families. They cannot talk with the physician. It's very sad for the patient. When they get out, it's like a reborn for the patients. The real lesson this disease shows us is that science is very important to deal with an enemy that we didn't know anything about.